Funding for Yale Cancer Answers is provided by Smilo Cancer Hospital. Welcome to Yale Cancer Answers with Dr. Anees Chagpar. Yale Cancer Answers features the latest information on cancer care by welcoming oncologists and specialists who are on the forefront of the battle to fight cancer. This week, it's a conversation about healing during the holidays with licensed clinical social workers Mary Strauss and Kelly Ford. Dr. Chagpar is a professor of surgical oncology at the Yale School of Medicine.
So maybe we can start off by each of you telling us a little bit more about yourselves and what it is you do. Mary, maybe we'll start with you.
Sure. I am a licensed clinical social worker in our hematology oncology unit, and I work with patients and families throughout the continuum of their care, and I also run support groups.
Okay. Kelly, how about you?
Yes, I am a licensed clinical social worker. I've been with the hospital for almost 18 years, about 8.5 of that with oncology. And I work with the palliative care team in bereavement services. I facilitate bereavement support groups, as well as provide grief seminars on educating families about grief and the grief process. And I also work in the radiation department in radiation oncology.
So important work that both of you do. And as we're getting into the holiday season and people are thinking about spending more time with family, oftentimes we think about Santa Claus and presents and joy, but a lot of patients might be going through cancer during this time as well. So, Mary, what are some of your tips in terms of, how to deal with your diagnosis and with healing, particularly around the holiday season?
So one of the most important things to do is to express your feelings to your family and friends. And if you're feeling exhausted, for example, you don't have to do all of the extensive activities, go to all the parties and events. So speaking openly with your family and friends is very important. You can change your expectations, maybe not overdo it, kind of create new traditions. Maybe instead of taking that trip to the family, you can instead have a nice family Zoom and do something a little easier. So I often tell people, say no to unrealistic expectations and yes to offers of help. And we are a society that does not really put positive emphasis on asking for help, but this is the time where it is important to ask for help. And I tell patients also, when you ask a family member or a friend to help out with a particular activity, you're actually helping them because people want to do something to make your journey easier. So, reach out when needed. Save your energy for the things that are important to you and that give you meaning. And always do something good for yourself. Maybe some people might take a walk or watch a funny TV show or something like that. But you have to have some balance in your life when you're going through something like this. And of course, being somebody who runs groups, I am always in favor of connecting with others through a support group and just basically taking care of yourself and knowing what you're feeling is okay. Any feelings that you're having of, maybe sadness, grief, anger, it's okay. It's all normal, and we're here to help you through the journey.
Yeah. Kelly, maybe we can get some of your tips as well. And I'm thinking about, cancer patients who this may be the first holiday that they're actually seeing family, because oftentimes the holiday season is when family who may not get to see each other on a regular basis might be getting together. Can you talk a little bit about some of the tips that you might have for people, particularly when it comes to, sharing their diagnosis and what that what they're going through. They may be seeing family for the first time in a long time who may not have seen them after their cancer diagnosis. And they may be feeling a little, ambivalent about seeing their family with this new diagnosis. They may look different. They may have lost their hair. They may not be sure about how to talk about cancer. Can you talk a little bit about addressing some of their anxieties and other tips that you have for them during the holidays?
Sure. Patients have different feelings about what they want to share and who they want to share it with. And it's certainly up to the patient and those who they feel most comfortable with to decide what they want to share with others. Sometimes it's, maybe talking to them before they see them and saying, when I see you this season, I might look a little different. I might have lost a little weight. Give them a little bit of a heads up or a time to talk or process, what happened. And maybe carve out some time when the family does come here to talk about it, to ask some questions. And certainly I always encourage patients to, if there's something you don't want to dive deep into or give details, you don't need to. You can just say, well, I'm working on that, or I'm not sure yet. I need to talk to my doctor about that. And so I think those things, could be helpful, especially if there's children involved, right? And children are going to be the first ones to point out how different you may look. That may be a great opportunity to sit down with children and talk to them about what's going on, depending on their age and their development and what's appropriate.
Yeah, and to that point, Mary, maybe you can pick up some of the conversation about how to break the news, how to talk to kids about your diagnosis. Because for some children, especially those who might be very young, it might be a little bit scary that, Auntie might not be doing so well, or she might look different, and she might have a medical condition that might be really scary for kids. Other kids who might be a little bit older might understand the diagnosis of cancer, but that too might be pretty scary for them, thinking about mortality from their own vantage point. So can you talk a little bit about how to talk to kids and broach the subject of a cancer diagnosis when you see them over the holidays?
Sure. Going along with what Kelly mentioned about developmental level, that's very important. How you're going to talk to a 3-year-old would be very different than how you speak to a 13-year-old. But we often tell families it's important to talk with your children in a way that you feel comfortable, but we recommend not using different words for cancer, just actually talking about the diagnosis itself, being honest and open, and making sure that their questions are answered. Maybe that 3-year-old might think, is this something I'm going to catch? So that's something you have to explain. No, this is just something that's happening to mom right now. And the doctors are going to help her through this. The 13-year-old might think, did I cause this, or am I going to get this when I'm an adult? So, alleviating those fears, talking about their feelings with regard to that. So we also think it's important to be as simple and to the point as possible. And again, as Kelly said, focusing on the developmental level of the children. Some kids might wonder how this is going to impact them. Well, Dad will still take you to your dance lesson and your brother to soccer practice, and our neighbor is going to be here after school when you come home, because kids want to know how this is going to impact them also. And we also have books. Thankfully, the Yale Auxiliary gave us a grant for some books that you can sit down and talk to kids with a picture book or, a storybook, and that kind of helps them to be a little more open. And the teens, of course, there are websites that we can suggest that they can talk to other kids going through a similar situation. But I would say that the most important thing is to let them know that it's okay if they're upset, if they're scared, as you mentioned, and that they're in a really good place. And we can't give you some answers to the questions like, whether mom is going to get sicker, but we can definitely tell you that they're at the best cancer center possible with the best doctors and staff, and that they're going to do a really good job. And we will keep you updated on how things are going.
Kelly, at the top of the show, when you were introducing some of the work that you do, you talked a lot about bereavement and bereavement counseling. And I can't help but think that, this might be a holiday season where for some families, there may be an open seat at the table. Maybe they've lost somebody due to a cancer diagnosis. And I want to kind of dive into how do those families deal with that open chair and processing those emotions and still having the family come together at a time of joy and celebration over the holidays when somebody they really love who normally they celebrate with isn't there. Can you speak a little bit to that?
Sure. Yeah, the holidays are a time when they're marked by togetherness, joy, celebration, and a lot of folks aren't there right at this time. They have lost someone very close to them, and they're not at a different place. And what we suggest to folks is spend time with those who are most supportive to you. And that sometimes may not be family members. It could be friends, neighbors, coworkers. Find those in your life who are most supportive and most open to you and where you are at this time in your grief. Allow yourself to do things differently. This holiday season might look different, especially maybe just for this year or maybe ongoing, but allow yourself to do things differently. Maybe traditions aren't going to be the same. Maybe they're going to be broken. Maybe for this year, you don't have the energy to host. We know how exhausting grief can be, and you may not have the energy to do what you normally do around the holiday season. We very much encourage practicing self-care. So whatever that means to you, whether it's taking extra rest and doing activities that are meaningful to you and that can help rejuvenate you, whether it's practicing mindfulness or meditation, journaling can be very helpful for people who are grieving. Any type of journaling, it could be writing down your feelings or writing to your loved one who passed. So self-care is extremely important for those who are grieving and going through this season.
Yeah. Such important and relevant advice for cancer patients and their families during the holiday season. We're going to take a short break for a medical minute, but please stay tuned to learn more tips for healing during the holidays with my guests, Mary Strauss and Kelly Ford.
Funding for Yale Cancer Answers comes from Smilo Cancer Hospital, where spiritual care offers support to patients seeking peace in the midst of their cancer journey, while respecting the unique philosophies, spiritualities, and religions of patients and caregivers. SmiloCancerHospital.org. The American Cancer Society estimates that over 200,000 cases of melanoma will be diagnosed in the United States this year, with over 1,000 patients in Connecticut alone. While melanoma accounts for only about 1% of skin cancer cases, it causes the most skin cancer deaths. But when detected early, it is easily treated and highly curable. Clinical trials are currently underway at federally designated comprehensive cancer centers, such as Yale Cancer Center and at Smilo Cancer Hospital, to test innovative new treatments for melanoma. The goal of the Specialized Programs of Research Excellence in Skin Cancer grant is to better understand the biology of skin cancer with a focus on discovering targets that will lead to improved diagnosis and treatment. More information is available at yalecancercenter.org. You're listening to Connecticut Public Radio.
Welcome back to Yale Cancer Answers. This is Dr. Anise Chagpar, and I'm joined tonight by my guests, Mary Strauss and Kelly Ford. We're discussing tips for healing during the holiday season for patients and their families who may be dealing with a cancer diagnosis. So, Mary, before the break, we were talking about, some of the tips that we have for patients and their families who may be going through cancer during the holiday season at home. And you were saying, maybe you don't want to go to all of the parties. Maybe you don't want to cook the big holiday meal, and somebody in your family might be able to take on that task this year. But, I wonder, there may be some people who are listening who have a member of their family or maybe themselves who are currently in the hospital right now facing a cancer diagnosis. And still, the holidays might be particularly difficult for them because, hospital rooms really aren't where we generally like to spend the holidays with friends and family. So what tips do you have for them?
Thanks, Dr. Chagpar. So I can speak professionally and personally about this. I know that when I was younger and my dad was in the hospital at the time, we brought him a little Christmas tree with tiny little lights. And what some folks do is they bring in their own decorations just to make it a little more cheerful. Staff do the best that they possibly can to make it as interesting and fun. Oftentimes you'll see a nurse with a Santa hat on or a colorful sweater. It can be extremely difficult to have that empty chair that you and Kelly were talking about, but you can also bring your celebration to the hospital. You can hang out in the room, and as Kelly said, it might look different. It might be, a family member and in the hospital bed and the aunts and the grandma sitting together in the hospital room, but they're enjoying themselves and having fun. And I think what's important about family is it's not a place, it's a feeling. And if you can bring that feeling to the place, the hospital room, then that's good, because that's what really matters, is not what we're doing, what we're buying. As long as you're together and sharing what's important to you and what's purposeful and meaningful together, that can be a very nice way to celebrate. And it doesn't have that same pressure, too. And then, if you're home and you can't get to, say, mom at the hospital, luckily with technology these days, we have, FaceTime and iPads and things like that, where you can connect virtually.
Kelly, the other thing that we haven't really talked about are the fact that kids get cancer too. And, Christmas particularly, but all of the holidays really are particularly important events for kids. They look forward to hearing those little hoofbeats on the roof and awaiting Santa and putting out the cookies and milk, and rushing down in the morning to look at what Santa brought and opening those presents under the tree. What do you do for kids who might be in hospital this holiday season to make their Christmas just a little bit more normal? How do you help kids deal with the fact that they've got cancer during the holiday season?
I think similar to what Mary was saying is that to do whatever you can to make the season and that day special for that child, whether it's decorating their room or bringing in a special gift. I know the hospital does wonderful things with gifts, and at that time of year, and the staff are wonderful as well with helping the kids to feel as much at home as they can. And also, if there's traditions that families enjoy and like to do, it always can be done later at another time. If it's the time, when they need to reenact, in February, what was supposed to happen in Christmas, that's okay too. It doesn't mean it doesn't have to happen. It could just also happen at another time.
Yeah. And Mary, to you, how do you know if you have a child who has cancer, how do you know that they're doing okay during the holiday season? I mean, I find that so many of these kids, they put on a brave face, but sometimes they're struggling. And how do you know when that's the case? And how do you help them emotionally?
Well, I think it's important to make sure that the child feels comfortable to be open with you and express their feelings. It's also helpful to engage the services of the pediatric oncology social worker. We have folks also called child life workers who can sit down with a kid and maybe play with a toy and talk about their feelings. So the importance is the honesty and the openness, and just kind of going with how the child feels and validating that, and letting them know that their feelings are valid and okay, and that you're there for them.
Yeah. It's such important messages. And Kelly, I think that a lot of that resonates with adults too. I mean, I think about, patients who have gone through cancer, and they too try to put on a brave face, particularly around the holidays, where they're trying to show that mom's okay. Mom's going to do everything that she's always done. She's going to be here. Everything's just fine. But deep down inside, mom might not feel quite so okay. She might not have that energy. She might have her own anxieties and her own feelings of fear and trepidation with her cancer diagnosis, wondering whether this holiday might be the last one that she'll get to spend with her family. Can you talk a little bit about how patients can kind of self-monitor their feelings and their anxieties, and when they should really reach out for help to a social worker, to a trusted friend, to a colleague? Can you talk a little bit about that?
Sure. Yeah. A lot of times, those are the patients that social work works with. No matter when it is during their treatment, whether it's right at time of diagnosis, or sometimes it's even later after treatment, that they're feeling down with the now what's and the fears of reoccurrence. And so no matter when it is or at what time, social work is able to work with those patients and to really, talk about those feelings, those concerns. Sometimes it's recognized by staff. This patient, and referred to social work, this patient looks like they're having a hard time, or they've been really, really upbeat. And lately, this patient hasn't been upbeat like they normally are. So those are some flags that staff can recognize and refer to social work. If it's something that the social worker feels like maybe they need additional support, whether from an outside therapist, or from a psychiatrist. So those are things that we can assess too with the patient, and just decide what's the best course of treatment for them, and what would help them to get through this time.
Yeah. And Mary, maybe you want to talk a little bit about, when we think about treatment for patients, oftentimes for cancer patients, we are thinking about surgery and chemotherapy and radiation, and many patients may just want, particularly as they're getting through their treatments, they're struggling with things like nausea and fatigue. Can you talk a little bit? They may have an interest in things like massage therapy or other integrative forms of therapy that might help them kind of get over some of those side effects of traditional therapies. Can you talk a little bit about what things people might be considering?
Sure. I am a big fan of integrative therapies. There are programs such as, as a result of COVID, a lot is online, but you can do a yoga class online, Qigong, Tai Chi, all from the comfort of your home. Some of the other programs are art-based, such as writing poetry. There's meditation classes that people can attend. Kelly mentioned the mindfulness. So I know, for example, at the hospital where we work, we have some mindfulness programs that are online. So, because getting, into the hospital might be difficult. So engaging in some of those things that take your mind off of the cancer and help you to relax are really helpful. And it gives you a sense of normalcy and a sense of hope and inspiration to engage in those types of activities.
Yeah. I mean, both you and Kelly, you had mentioned the whole concept of mindfulness as well. What do you say to patients who say, I'm not really sure about this whole meditation thing. I'm not really sure about yoga and journaling. It might just not be for me. What do you say to patients who kind of tell you that, I'm not really sure about all of that?
Yeah, and it might not be for them. But mindfulness, there's many different ways you can go about it. So if journaling is not for you and sitting down in silence with your eyes closed is not for you, there's also other ways to accomplish the same goal. You can do a walking meditation. So if you like to be physical and be outside in nature, you can walk and you can take in all the senses that are around you and practice mindfulness that way. So there's many different ways it could be done.
Yeah. And I think that point is so good. And Mary, back to you, one of the things that you had mentioned earlier on was this idea of connecting with other people and support groups. Can you talk a little bit about how people find support groups? I mean, are these for everybody? Should they look for particular support groups that are for their disease type or for their age group? Are these available at only major cancer centers? Are they available in the community? Can you talk a little bit about that?
Sure. So a person can go online to your particular cancer center or different websites such as cancer.org or cancercare.org. A lot of the informational organizations can point you in the right direction. You might have a group that has different types of cancer, and they're all amazing because they help each other. They feel a sense of safety and camaraderie. These are people that understand what you're going through, and you can say things that you might not want to say to your family that are, important to you.
Mary Strauss and Kelly Ford are licensed clinical social workers. If you have questions, the address is canceranswers@yale.edu, and past editions of the program are available in audio and written form at yalecancercenter.org. We hope you'll join us next week to learn more about the fight against cancer here on Connecticut Public Radio. Funding for Yale Cancer Answers is provided by Smilow Cancer Hospital.